everybody. Good morning. It's Martha Kennedy, and I wanted to talk to you today about medication. Now, as we know, and probably as we learned in school, there started out as 5 rights for medication administration. But as things went over, we added a little more safety nets, and so there became, you might have heard of 7 rights, 9 rights, 10 rights, 11 rights. Well, today we're going to start with the first 5 rights, and we'll go through those, and then I'll tell you the other rights that were for added safety. So let's talk about it. As a nurse, you know that we are the last safety net for these residents, okay? And many times, just by using my 5 rights, I have avoided any medication errors or come up with some type of, maybe they had an allergy or whatnot. We'll go through those. Speaking with the doctor on these things, or if there was a duplicate order even. So the first right we should all know is the right patient. So you want to make sure that you have the right patient, and on PCC we have a picture of the resident. If you're unsure, you should ask somebody and get that clarified. So that's the first one. Then the next one is the right medication. Now, when you're looking at the right medication, we're looking to make sure this is, Synthroid. Yes, this is Synthroid. Does it fit the description on there? But we're also looking to make sure that it's not expired, okay? And that the patient doesn't have allergies. That should already be alerted, but just to make sure. Sometimes if you might get something out of the ER box, you want to double check that also. So you're also making sure it's not expired. And then we want to look at the right dose. Now, a lot of times it'll come in a pill form in a blister pack, which will tell you the right dose. But many times it will say, 5 milligrams to 1 ml. And so check the math. Check the math on that, okay? Just making sure it's right for the dose you're giving. Then we have the right route. Okay, there's many different ways that medication can be given, and we know the right route would be either by mouth, that's the most prevalent, or it may you may have somebody that has a gastric tube, and you might look at the order and say, oh, it says by mouth. Maybe somebody wrote it like that. Clarify it, that way everybody knows and no one's trying to give it by mouth. So that's the right route, okay? The 5th one is the right time frequency. Okay, so the right frequency is how often it's given and how many times a day. Now, you want to look at this extra especially because you want to look at it to make sure it's not too late and not too soon. Okay, that helps with some PRN medicines too, so you want to look at that. So those are the 5 rights, that we started with: the right patient, right medication, right dose, right route, and right time or right frequency. Okay, so then we added, over the years, they've added some more rights to guide you and help with patient safety. Okay, so number 6 we'll say number 6 is the right reason. So, you want to make sure that you know the reason that this medication is ordered. What is it used for? Think back to pharmacology. Think back to why is it being used for, because we want to make sure that perhaps the doctor didn't write this on the wrong patient. So what is it used for? Right reason. And then the next one is the right assessment. Now this is where what do I need to do before I give the medicine? You've seen many times we have to take a blood pressure before we give medicines, or maybe if the patient's on a beta blocker, we know that slows the heart rate. So a lot of times we got to make sure that the heart rate is at the right, within normal limits and not too low, so that we don't slow it down more. Insulin, we got to make sure that the blood sugar is okay before we give it. On some of them, or Coumadin, have we checked the INR? So that's the right assessment. Then we have the right education. So this might be a patient that says, oh, I haven't ever seen this pill before. So we want to tell them the name of the medicine and the generic also name, because sometimes it may be different or look different from what they're used to. Then we have right documentation. So this is really important. This is important, especially in PRNs, that you are documenting when you give it, so that the person coming after you, the next nurse, knows when it is okay to give again, or if it's already been given. What if they're transferred to another hall? They need to know that. The next one is called right to refuse. We know that the residents have the right to refuse, but we don't want to stop there. We want to ask why. Does it make you feel bad, or do I need to explain it? Is it anything about this medication you don't know why you're taking it? Feel free to explain that to them, and then document those reasons and communicate it with the prescribing MD. Then we have the right evaluation. So, did this have the right effect on the patient? For instance, I gave them a pain medication. Did I come back later and make sure it worked? Did it have the right effect? If it's supposed to be for blood pressure, is it helping lower it? Do I need to call the doctor and let them know? So that, in a nutshell, is all of the rights, the basic ones, and then the ones that have been added on. I appreciate your time, and please always let us know if you have any questions. Thank you.